One of the key ways healthcare providers say we will get through this crisis with the coronavirus is with collaboration. And joining us now with how that is already happening is medical reporter Liz Bonis. Liz.
It's been amazing to see. Hello to you once again. Dr. Kevin Joseph joining us from Tri-Health. He's the chief medical officer there and an emergency medicine physician. I know your team has, for lack of a better way to say it, really been leading this. Earlier today, they shared with us that they have set up extra staffing for emergency medicine. They hope at least that the staff can accommodate what is needed for treatment and testing. We were in there. This gentleman here, his name is Drew, actually led us in his testing. But they're part of a larger communication system of sharing with what's called the Health Collaborative.
From the get-go, our hospitals, as much as they may compete on other fronts, are working together to have all the data that they may need to be prepared as best they can.
Representative Brad Wenstrup, of course, part of the team helping to round this up. Now, you're doing a lot of things to sort of work together, but I've been asked a lot about ventilators and things like that. Will you share amongst hospitals if needed?
Yes. So at the end of the day, we all have a mission of treating the community and make sure the community is healthy and they get the treatment they need in an acute episode. That's the bottom line of all of our missions. And so if one hospital system does not have something, they're running out of something, we do share. We've done that in the past, and we'll certainly do that in the future in this current situation. And the hospitals are coming together through the Health Collaborative on a daily basis for a conference call. Sometimes it's an hour, sometimes an hour and a half, and occasionally we'll have a couple calls per day to make sure that we're on the same page, what we're doing with policies, processes, as well, and how we can share best practice as well as equipment at some point.
So we have a little video. I know one of the things we got to see was some of your testing going on today. You got the kits in finally. I know we're going to be having drive-by locations soon, and then also getting results back more quickly than we've been able to?
Yes, absolutely, which is great news. About a week, 10 days ago, the only location that would test is the CDC. And so we had to send it there. There was a backlog. It took about a week to get the results back. And then the CDC opened up the testing sites across the country, just a few select sites. That is expanding. Once they opened that up, the turnaround time came to about 2 to 4 days. Now they're getting backlog. And so now more testing sites, including Tri-Health, is going to be able to have the test and run it, and we'll have the results in several hours instead of several days.
Boy, that'll make a difference. We want to thank you for hanging out with us these couple hours. We are back at 6.